Колеги, продовжуємо наш робочий день в прес-центрі Українського кризового медіа-центру.
Our working day, I'd like to invite Ulana Suprun, acting Minister of Public Health of Ukraine, will be talking about procurement of the medicines by international organizations. Ulana, the floor is yours. Thank you. Good morning. Greetings. That's great that there is such an interest to such an important thing. In 2015, Ukraine for the first time has done procurement via international organizations. We changed the system of procurement of medicines in Ukraine, and we were not mistaken. Why? There are no old schemes. In most procurements, there are no intermediaries. The tender monopoly has been overcome. About 40% of those that won the tenders, Ukrainian producers are new suppliers and producers of medicines. This year, we have twice more producers participating in tenders, out of them many Ukrainian plants. Many medicines were procured from producers, like 100% medicines for orphan diseases were procured directly from the producers. We saved more than 790 million hryvnias compared to 2014. Additional medicines and vaccines could be procured for this money. Despite the crisis in Ukraine and the reduction of the state funding, the 87% to this year we received only 87% of what was received in 2014, but we increased the amount of medicines bought by 55%. That's also we managed to bought medicines, high-quality medicines for orphan children, and we are now procuring the medicines that are used all over the world. The procurement of medicines by international organizations will be taking place this year and next year. In the tenders of the Ministry of Public Health, there will be no corruption anymore. We are acting via highly respected international organizations, but we understand that there were difficulties with these international procurements, and that's normal. That was the first pilot year. We collected information and analyzed where there were the delays to speed up the process for 2016-2017. You see the infographic of how the procurements were taking place in 2015. Most time Ukraine was spending to approve laws 1.5 months, and development of regulations, signing the agreements that took 8.5 months, and 2 months were needed to pay all the money, to transfer money. The money were transferred in December 2015. Today, we have supplied 100% medicines for orphan children and the children with hepatitis. Different international organizations have supplied most of the medicines and vaccines, the medicines and vaccines that were ordered in January and February this year, because the funding arrived only in 2015, so the orders that were made via international organizations so that they can order these medicines in 2016, they were not in the warehouses. The producers had to make them from the very beginning, and that requires about 10 months. Some other medications which are brought to Ukraine are waiting for for the documents to be signed. When I came to the ministry, there were no people who were working in this department. There were vacancies. Some people were on vacations. During the last 2 weeks, we signed many documents to unfreeze this process. We delivered 48% of the ordered medicines to the regions. The other medicines are waiting for the orders to be signed. The bureaucratic process is very lengthy. The act is to be signed, the order is to be issued, and then only they can take medicines to the regions. It takes 3-4 days for all the acts to be prepared. We already have ready contracts for 2016. We are starting to select international organizations. You should understand why we are cooperating with these organizations. The law named specific organizations with which the ministry could work. These were Crown Agency, Global Drug Facility, Partnership for Supply Chain Management, NATO Supply and Procurement Agency, and the UN, UNDP, and UNICEF. When we address these organizations, only Crown Agency and the United Nations, UNDP, and UNICEF replied that they want to cooperate with us. Other organizations did not provide any response. That's the reason why we are cooperating with these three organizations. For 2016, we have prepared and we submitted the amendments to the regulation, to the resolution to simplify bureaucratic procedures. We have submitted the documents to the Cabinet of Ministers, the list for procurement for 2016, and we developed the roadmap for tenders for 2016-2017. Today at 4 o'clock in the ministry, we will get together the working group of the people from the ministry who are working on state procurements, the lawyers, the volunteers who provide advice to us, and representatives of patient organizations to develop a clear action plan and to define deadlines so that by the end of this week, next week, we have the roadmap and everything will be planned for the next 6 months. Everything that's happening in the ministry should be transparent and clear. We have prepared new expanded table with all the information on supply of medicines to Ukraine and taking them to the regions. That information is on the website of the ministry. It's a very detailed, expanded list, which shows in detail what's happening. There are the names of the medicines and vaccines, from which organization they were bought, who's the producer, how many were ordered, how many were delivered, and where they were taken to the regions. We have this is like vaccines, medicines for oncology patients, and so on. We are also ready every second Monday to update the information. If there are questions whether the medicines are in the regions, whether the medicines have been supplied that were promised by Crown agents, so that you can see this information. We want to be open so that you can see how that's all happening, so that there are no questions, so that the journalists or social networks do not distribute any rumors. You could see the truth so that the process starts working. We are waiting from the Cabinet of Ministers the approval of the list of names and simplification of some of the procedures. And the most important thing is the rest of my team should, we were waiting for the rest of my team to come to the ministry, because myself and Roman are trying to work where there should be 6 people working. You understand that in the Ministry of Public Health there's a lot of work, there are many things many things happening, and we need the team to be there to be able to work more efficiently. So we are waiting for approval of the deputies, and we hope that during the next meeting of the Cabinet of Ministers, all the deputies will be appointed, and then we'll be able to work more efficiently. Also, I would like to tell you, I know that you have many questions, but I would like to start with the questions. I have time till 11:30, then I will have to go because we have a lot of work. But I'm ready to answer your questions. I shouldn't want the patients to wait for the medicines for vaccines. Thank you.
Thank you, Ms. Ulana. But before asking question, please mention your names and stick with the topic. Vladislav Dolitsky, 1+1 TV channel. But it's not up to the topic, but the situation in Sumy about the death of a child. The Ministry of Health had prohibited some medicines for use. Whether we have some substitutions for those medicines and for how long period this ban will be in place. The medicines which you mentioned, they are not from that batch which are to be supplied by the international organizations. Our department dealing with the medicine supplies is currently sorting out this issue with the death. Also, Roman Elek is involved to our internal investigation. The state buys only part of that, procures only part of that medicines, which are used in the ambulances and in state hospitals. Partially, the medicines are procured by private organizations. Unfortunately, I cannot answer your question by the moment we finish this investigation. Victoria Sanek, emergency news. Now, could you please explain how long the medicines are supplied for children with oncology would stay in Borispol Airport waiting for customs clearance? Yeah, you're right. The medicines were supplied via Crown agents to Ukraine. They were paid taxes. When Crown agents purchased that medicines, they understood that taxes would not be paid back to the distributor, but distributor now wishes to get that taxes back. So currently there are negotiations about paying back the taxes, but that's not due to the Ministry of Health, but this delay is due to the dispute between Crown agents and distributors. We cannot speed up the process. We communicate continuously. RBK Ukraine, is it right that the SBU submitted a letter to the Prime Minister of Ukraine requesting to carry out an audit of all the procurements of medicines? Could you comment on this? And please comment on whose account the medicines for 2016 will be procured. we have prepared the contracts for international organizations funding for this year, but we're waiting for approval of the lists of those medicines to be procured. Again, I would like to mention that we have just Crown agents and 2 UN organizations as suppliers of those medicines. As for the letter from SBU to the Prime Minister, I think that's not a question to me. Probably you should ask the Cabinet of Ministers. As for us, we are ready to be involved in any research or inquiry about that issues. We do not see any corrupt actions on behalf of the UN organizations and Crown agents. The latter was about different procedure or different mechanism. First of all, the mechanism or the procedure is set by the law of Ukraine and by laws of the Ministry of Health. If the procedure, if the issue is about procedure set by the Ministry of Health, then we are ready to respond directly to the law enforcement agencies. We are very much committed to remove any possible ways for corruption from the procedure and to bring these medicines as quickly as possible to Ukraine and to disseminate them to hospitals, family doctors, etc. But we are very much concerned with the delays. We have August now, and we have not signed the contracts with international organizations yet, because any delay causes problems at later stage. Some issues required 2 months. For example, it takes long time to transfer money to our international partners because there's a big amounts of money and we have to pay this money in currency. The National Bank required a lot of time to buy currency first, then to transfer this currency to the sailors. And currently, we negotiate the procedure that we would have that currency ready on our bank account of the Ministry of Health, and that this would enable us to transfer this money immediately upon signing the contracts. Of course, this is the pilot program. We understand that the difficulties are inevitable, but we do not wish to blame everybody. We just wish to learn lessons from these difficulties to make the procedure as smooth as possible in the future. In order to make this procedure functioning very smoothly next year. So we have to analyze all the obstacles, all the issues in the procedure, and learn lessons in order to supply medicines to our patients regularly. Natalia Prudka. Ms. Natalia, 2 months ago, at one of the press conferences, it was stated that the medicines which were procured by international organizations are blocked somewhere and that they are not supplied to the hospitals. So my question is whether you managed to release those medicines, supplied medicines from the warehouses and to supply them to the hospitals. Could you represent yourself, Natalia Prutka, Globcom?
Thank you for your question, Natalka. In the last 2 weeks in the ministry, we signed up to 100 documents, and these were just for distribution of the medicines to the regions. As you can see on our website, there are many which are on the warehouses, in the ministry, but are not delivered to the regions. There are many of them. Now our financial department is working on drafting the acts. I signed everything, and we will be sending the medicines. You will see that most of these deliveries were taking place before the 1st of August. These are the medicines which are sitting there for more than a month, others for 2-3 weeks. There's a requirement that this should come to the regions in up to 10 days. That's the working group which will be working. It will be helping us to analyze why the deliveries have not been made timely. What's the problem? Whether that's the problem in delivering documents so that we can decide. I can say that in the last 2 weeks, 2 or 3% arrived. We are delivering and then they distribute between themselves. As you could see on our website, we distributed how many doses of the vaccines were delivered when there's a problem that it's in the oblast. Then you have to demand you have to address if this is not happening, then you can come to us and we will see why it's not happening. There are delays, but we're working hard on that so that you understand we will not be just insisting that the employees of the ministry should be helping us, but also NGOs, lawyers, volunteers, and also the representatives of patient organizations so that they can deliver the information to us which is outside the ministry. Because as you understand, we have documents and we base a lot of what we are doing on the documents, but the patients, the NGOs are somewhere locally and they can tell us, you delivered to Dnipropetrovsk Oblast, but it's not in my hospital. Then we can look at why it did not reach their hospital. Thank you for the question. That's very important. I agree to you. There are delays. I personally am working on that, but I also have involved a group of volunteers, of specialists who will be helping us. Yes.
We have 9 minutes more for press conference and 3 questions. Please be brief. Anna Lobova, Відомості України. What is the situation now with the BCG injections? We have assigned the documents. Currently, the UNICEF is delivering these vaccines, and probably the medicines would arrive today or tomorrow to our airports. We will need to clear them. And probably they will be delivered to the region soon. First, the UNICEF had difficulties with finding those vaccines which we needed, on the one hand. On the other hand, we had to find money. I communicate with all the international organizations delivering to us, UNICEF, UNDP, Crown agents. I speak to them every day. We inform them about delays, and they inform us about the needed documents. When we need to deliver the vaccines to regions, we immediately apply to our state delivery service. By the way, the customs clearance, it's not a problem. When the medicines arrive to the border, they are cleared immediately. The procedure is very cumbersome and complicated. Our working group is now thinking how to simplify it. The best way is to introduce electronic document circulation, but it's a problem. Stepan Sitnik, you mentioned that you submitted 4 more candidates to your team to the approval of the Cabinet of Ministers. Could you explain more about this? Currently, the Cabinet of Ministers reviews the CVs of those people. I think it's too early to mention their names, because the cabinet is now making its decision. And the last question for today. Good afternoon, Pravda Information Agency, Boris Tolkien. When Ukraine would refuse from any mediators and would approach to the suppliers to the producers of medicines. Ukrainian legislation as of the moment requires us to approach to international organizations and wire them purchase those medicines which should be supplied to people by the state. When this process is over, probably we will think how to introduce new procedure. By the way, you should know that many countries in the world purchase medicines via international organizations like UNDP, like UNICEF, etc. Of course, we can follow another way, but this change would take and could take several years in order to supply quickly quality medicines and to make this process transparent. Thank you for your attention. Thank you for coming. Goodbye. The next briefing will be at 12 p.m. sharp. We will have Vadim Skibitsky, representative of the main intelligence department. Thank you.